Prerequisite: study models poured up in plaster. Objectives: upon completion of this task, the student will be able to select and operate the equipment and materials necessary to trim models, trim plaster study models, finish and polish study models for use in the dental office, evaluate trimmed study models for criteria of acceptability. Materials and equipment: model trimmer, plaster models and wax bites, compass, Bowley gauge, pencil, ruler, number 7 wax spatula, lab knife, abrasive paper, cotton ball, safety glasses, pan of water, soap solution. To avoid damage to jewelry, all rings must be removed during model trimming. Procedure: remove the blebs from the occlusal and cervical areas of all teeth with the wax spatula. Soak models in water for 5 minutes. Using a lab knife, trim the excess plaster from the heels of the models so that the models can be occluded. Flatten the surface around the maxillary base on the trimmer. Place the maxillary model on its occlusal surface on the bench top. With your finger positioned toward the anterior of the base, adjust the compass to the lowest height of the base. Slowly rotate the model, inscribing a line on the flat surface of the base with the compass. Trim the base of the maxillary model to the inscribed line. After trimming, the base should be parallel to the bench top when placed on its occlusal surfaces. On the maxillary model, mark the midline suture, using the ruler as a guide. Locate the maxillary tuberosity of the most posterior tooth in the arch. Using the Bowley gauge, measure and mark a point 3 millimeters behind this maxillary tuberosity. Mark a line perpendicular to the midline suture, intersecting the point you marked behind the maxillary tuberosity. Trim the back of the maxillary model to this line, resting the base of the model on the trimmer table. On both sides of the maxillary model, locate and mark a line that follows the central groove on the occlusals of the bicuspids. Draw a line 6 millimeters, or about the width of a pencil, from the buccal surfaces of the bicuspids. This line should be parallel to the central grooves on the occlusals of the bicuspids. With the model resting on the trimmer table, trim to this line on each side. Check that the lines form equal angles with the back of the model. If not, adjust slightly. On the maxillary model, locate a line running from the center of the cuspid to the midline suture on each side. Draw lines 6 millimeters from the labial surfaces of the anterior teeth. These lines should be parallel to the lines from the center of the cuspids to the midline suture. Trim to this line on each side with the model resting on the trimmer table. Check that the lines form equal angles with the midline suture and the side angles are even with the centers of the cuspids. Flatten the surface around the mandibular base on the trimmer. Without using the wax bites, occlude the models, resting the base of the maxillary model on the bench top. Adjust the compass to the lowest height of the mandibular base and slowly rotate the models, inscribing a line on the flat surface of the base with the compass. Trim the base of the mandibular model to the inscribed line. When the models are occluded, the base of the mandibular model should be parallel to the bench top. Using the wax bites, occlude the models. Rest the base of the mandibular model on the trimmer table. Trim the back of the mandibular model to the back of the maxillary model. To check the accuracy, place the occluded models on their back on the bench top. If the bite does not open, the backs are even. If not, adjust slightly. With the models still in occlusion, rest the mandibular model on the trimmer table and trim the sides of the mandibular model to the sides of the maxillary model. On the mandibular model, draw an arc, following the anterior curve of the arch from cuspid to cuspid. Keep the line approximately 6 millimeters from the labial surfaces of the anterior teeth. The anterior arc should meet the sides of the models 6 millimeters labial to the distals of the cuspids. Trim the anterior of the mandibular model to this line. On the maxillary model, mark the heel lines 15 millimeters wide and parallel to the mesial distal plane of the opposite cuspid. Trim to these lines with the base flat on the trimmer table. Using the wax bites, occlude the models. Trim the heel lines of the mandibular model to the heel lines of the maxillary model, with the mandibular model resting on the trimmer table. Remove blebs from all tissue surfaces with the wax spatula. Using a lab knife, smooth the edges of the bases, being careful not to touch the soft tissue surfaces. On a glass slab, mix a paste of plaster with your finger. Fill in any holes in the bases of the models. Allow to set for 30 minutes. Moisten the abrasive paper. With the abrasive paper on the bench top, smooth the bottoms of the bases. Hold the models in occlusion. And smooth the backs, heels, and sides. Holding the maxillary model, smooth the anterior portions. Holding the abrasive paper, smooth the anterior arc of the mandibular model with very light pressure. Allow models to dry thoroughly at least 24 hours. Submerge dried models in soap solution for 1 hour. Remove from soap solution and rinse off excess soap under gently running tap water. Allow models to dry. Polish models with moist cotton ball until glossy. The student will evaluate the models for criteria of acceptability. Verify your evaluation of models with the instructor.